Time to get started. So I have the pleasure today of passing the baton now on to Alex Simon, who's on our board and has worked in this field for quite a while. And I'll let him introduce himself with specifics, but he's going to be the moderator today and take over and introduce Sam and Graham. Thank you so much, Alex.
Cool. Thanks, Anne. And hey, everyone. It's great to be with you all. Welcome back from the break. As Anne mentioned, I'm Alex Simon, very proud BPRG board member, and I guess depending on your perspective, long time engaged in this space, or a very, very, very short time if you're Rick Doblin or of his ilk. I got involved in this space, I guess, about 6-7 years ago. Specifically in collaboration with my dad, who is also on the BPRG board, and I'm sure many of you know, to do whatever we could to impact the mental health crisis through the lens of advancing access to psychedelic research, medicine, therapy, healing. That's led us in a variety of hopefully impactful directions, led us to cross paths with Graham and Sam on many occasions, and is currently taking the form of advancing a drug discovery oriented venture with some scientists and physicians we came to know well at Massachusetts General Hospital, a company called Sensorium Therapeutics. But today I'm really, really excited that we have Graham and Sam around the table to talk to us about what's going on in Oregon, their work advancing access to this medicine in very thoughtful and intriguing ways, and what's coming down the pike just this upcoming year, which will likely represent a paradigm shift in how we think about access to psychedelic medicine and healing. I'm going to introduce Sam and Graham in just a moment, then they'll take the floor for a while. Of course, if you have any questions at any point, please just type them into the chat, but we'll have a robust Q&A, I'm sure, after Graham and Sam have had the time to share a little bit about what's going on. As many of you know, about a year ago, last year, a ballot measure passed, or no, two years ago, or however, they'll get to the specifics, but a while back, a ballot measure passed in Oregon that set the stage for what we'll talk about today. There's different folks on the line. We've got researchers, therapists, practitioners, folks who might be interested in learning more about and plugging into Oregon and what's going on there in a variety of ways. So Graham and Sam will certainly spend some time establishing a common base of understanding for what's happening in Oregon. And then we'll likely dive into what it actually means for practitioners, either from in Oregon or out of state, who are curious. And similarly for researchers, what the implications of what's happening in Oregon mean for access to research and increased data around how these medicines impact us. And then finally, we figured, given that we have two real leaders and experts in advancing this work in different ways across the country, we're happy to talk about for folks who live in Massachusetts and are curious about Oregon as a model, what that could mean further east on this coast. And as an aside, I'm dialing in from my home in Asheville, North Carolina. Despite growing up in Boston, I am the honorary BPRG board member who does not currently reside there. So in any event, I'm gonna briefly introduce Graham and Sam, and then we'll hand the reins to you guys. Graham Boyd is an attorney specializing in efforts to reform drug laws, reduce mass incarceration, and support science-based access to healing. He is the co-founder and executive director of the Psychedelic Science Funders Collaborative, a nonprofit community of philanthropists committed to supporting scientific research into psychedelic treatments for mental health and wellness, and creating effective, equitable access to these treatments for anyone who can benefit. He's also the founding director of New Approach Advocacy Fund, leading statewide campaigns to create legal access to cannabis and psychedelic therapy. Graham has a long and storied career advancing this and similar work, and it's been a personal pleasure to get to know him a bit over the last several years. Sam Chapman is the executive director for the Healing Advocacy Fund, a nonprofit organization supporting the implementation of Measure 109 in Oregon with education and advocacy. Sam has over a decade of experience in advocating for progressive drug policy reforms at the local, state, and national level, and has extensive, past experience relevant to this work. Most recently, he served as the campaign manager for Measure 109 in Oregon, the law that, as we'll discuss, legalized the first ever psilocybin therapy program in the United States. And notably, Sam has been a resident of Oregon for the last 25 years. And less notably, I was a resident of Oregon for 2 years. So this topic has personal interest to me. But in any event, enough for me. Graham and Sam, the floor is yours.
Welcome.
Great. Well, it's really wonderful to be here. I'm going to speak for a little bit and then hand it over to Sam, and then we'll go back and forth some. Let's see, just a bit of context. I'm joining you from Santa Fe, New Mexico. So, and you're not the only one there. And it's with a certain kind of heaviness that I'm joining you from New Mexico too. I have a close family member who has been struggling with cancer for several years and is in the final probably days of his life right now. And as I'm sure any of you who have been close to death appreciate, it sort of really puts you in touch with your own spirituality, your own sense of what's important and what matters, and it can be quite grounding. And that's what I'm finding it to be for me too, even as we're in the midst of, a lot of very important work to implement this Oregon law and to try to pass a similar law in Colorado and other pieces of work. Just offering that context of, to me, this is one of the reasons why the work really matters, is to, I think for many of us, kind of understanding our relationship to death, our orientation to death, and the Hopkins and NYU studies, document this, but really the way that psychedelics can open our hearts, clear our minds, and put us in touch with things that are bigger than just, the tasks that are in front of us in a given day. So that's where I am right now. So with that, I want to start with a little bit of a story. I started PSFC, Psychedelic Science Funders Collaborative, 6 years ago with Joe Green. And we gathered together initially a small group of people that included Bob Jesse and David Bronner, a few other people, Cody Swift, and really, asked the question of if because we believed there was at that time a tremendous potential of new philanthropy coming into the space, where might that be best directed, and how could we sort of serve to catalyze that? So there was a bit of a blank canvas to start with, but we came very quickly to the view that getting one psychedelic substance through FDA approval would be the single most catalytic event that could happen. If that happened, so much else would follow. And it would build on all the research, the academic research that had been done, but getting that FDA approval would really make a huge difference. And so we were all in on that. And we looked at the different contenders for FDA approval and quickly determined that MAPS with MDMA-assisted therapy was by far the most likely to get there first. So we were all in on MAPS, all in on the FDA. And this talk isn't about that, but there were a bunch of activities that led to a really wonderful partnership with MAPS. And many of you on this call were involved in that in various ways. So it was really out of left field that I heard from Bob Jesse, actually heard about efforts to advance psychedelic policy at the state level through legislation or ballot measures. And the first measure I heard about was a group in California that wanted to legalize psilocybin mushrooms for anyone 18 years old for any purpose. And so it would literally be sold in the 7-Eleven or the grocery store right next to the Portobellos and the Shiitakes. All you need to do is show that you're 18 years old. And I thought, oh my God, this is a horrible idea. This is so dangerous. This is like moving too fast. It has a lot of risk to it. I thank goodness it cost $20 million to get on the ballot in California, which will probably prevent this from going forward, and it did. And then in short order, I heard there's another group in Oregon, and I thought, oh my God, they're everywhere. What is going on here? This is no good at all. And still was in that kind of like, fixed idea that we needed to somehow or another, see if we could head this off. And but Bob Jesse encouraged me to talk to Tom and Cherie Eckert, the couple who started the Oregon ballot initiative effort. And it turns out they'd been at it for about 5 years, and they were both therapists and had a very different model. It wasn't psilocybin mushrooms for sale to 18-year-olds in grocery stores, but rather it was regulated access with with trained and state licensed guides or facilitators, and a lot of restrictions to it. And also just talking to Tom and Cherie, I realized they were quite sincere and good people. And so I and a few others started talking to them more and kind of imagining a redrafting of the initiative that would have an extended implementation period, that would put into the foreground cooperation with federal officials, and it would put a lot of safety kind of guardrails around it, making clear that this was not legalization, but rather it was state regulated access. And part of me was like, well, look, if we don't get involved, then this sort of much broader version of what that California initiative would probably go forward somewhere. Far better to do this more narrow version. So I initially sort of thought of it as harm reduction. But the more I got into it, the more I realized, no, this is actually a good thing, not just a forestalling a bad thing, but actually a good thing. And what I mean by that is that I came to believe, and now very much do believe, that this state regulated access route is a complement to the FDA approved route. And so let me dig into a little bit about how these two complement each other. One factor is timing. It takes a long time to get through the FDA. MAPS will, we hope, in the next year or two, get approval for MDMA-assisted therapy for PTSD. And over time, that will probably be expanded through off-label or additional approvals for other medical indications. And maybe 3 or 4 or 5 years from now, psilocybin might get approved, and eventually that gets expanded for other indications. Some other of the psychedelic substances that are, like ayahuasca, it's hard to imagine exactly what that approval process looks like through the FDA, but maybe it will happen. But time is a factor. And in the meantime, I believe that there is sufficient evidence to show that it can be helpful and that the harm or safety issues are manageable such that there should be other routes of access, and better that it be regulated than it just be a free-for-all or underground. We could have longer discussions about that, but that's a view that I've come to embrace. So having it available sooner to help people sooner is the time factor. There's also the cost for approval. Typically in the pharma space, getting approval for a new molecule from beginning to end is somewhere between $500 million and $1 billion for each one. And for the molecules that have already been in existence for a long time that aren't subject to patent, the cost is probably more in the hundreds of millions of dollars. But it's still quite a lot for each of the molecules and arguably for each of the indications. To pass a statewide ballot initiative in Oregon, we spent about $7 million. In Colorado, we will end up spending between $8 and $9 million. And I think for about $100 million, we could probably go through the state legislative process and state ballot initiative process and have legal access to the array of plant medicines for people in a state regulated model. So there's a kind of cost argument there. There's timing, there's cost. There's also the breadth of access. So I think there's a lot still to be discovered about how this is going to work. So I'm not saying that this is, like the exact truth, but at least pharmaceuticals in general, once they are approved, have to be prescribed by a physician. They have to be within a medical system. And I think for the substances that are coming off of Schedule I, there will probably be REMS or the sort of federal guidelines that will make it much harder to prescribe off-label. And so while MDMA approval, we hope will happen soon for PTSD, the other use cases will, I think, probably take a little bit longer. And in any event, will require a medical diagnosis. Under a state regulated model like Oregon, access will be for anyone who is an adult and who is assessed to make sure that it is safe and appropriate for them to use it, but you don't need a medical diagnosis. So think of the person who is at the end of life and who is having essentially a spiritual crisis, a sort of the worry of what comes next. Now, sometimes that person would be diagnosed as depressed or having an anxiety disorder. And so that's sort of what the Hopkins trial was about. But for many people, they wouldn't have that diagnosis, and yet they could benefit tremendously, I believe, from access to psilocybin in a guided context to really orient towards the death that is coming so soon. That will be available in Oregon. Similarly, I imagine many people on this Zoom meeting have accessed psychedelics in the underground and have done so not having any particular mental health diagnosis, but yet have benefited tremendously. That's also something that this Oregon state regulated model allows for, that the medical model doesn't allow for, and to the extent that people did have access to it, it would be sort of with a nod and the wink of we'll give you a diagnosis of quote unquote an adjustment disorder. And maybe that will happen eventually, but I'm not confident that it will. So that breadth of access is important. Now, there's the question of safety, and I think that that's the reason that I had qualms about the state-regulated model in the first place. And I think it's something to take very, very seriously. And I think the implementation process that Sam's going to talk about does take seriously. Now, again, I'm not claiming to have all the answers here. And I think it's a collaborative and iterative process. But I think there is so much more possibility of safety in a state-regulated and licensed environment than if you don't do that. People are going to be accessing these substances, whether we create these state-regulated models or not. And this creates the ability to make it much more safe than would happen otherwise. And I think ultimately, and this is a really interesting point too that I'd like you to consider, is that the federal regulation of drugs is really about the safety of the drug itself. Usually it's about the pill or whatever substance you're putting in the body and what happens with the body interacting with that substance. The FDA traditionally does not regulate therapy. And so much of the safety around psychedelics is the human interaction between the therapist or guide or facilitator and the patient or client. And that is going to be, even in the FDA approved route, that kind of regulation of therapy, setting the guidelines of what constitutes appropriate practice, is going to be determined by states, not by the federal government. And it will be professional boards, it's a setting of standards of care, but it will be done at a state level. And so looking to states to regulate psilocybin and psilocybin-assisted therapeutic interactions is actually a quite sensible thing. There's the overhang of federal law and illegality, which we can talk about too. But in terms of safety, I think states are actually the place that it really makes sense to be focusing. And then finally is the cost to the patient or the client. Now, because of the approval process for the federal FDA approval is so expensive, the cost of treatment will probably be higher on the FDA approved route. On the other hand, insurance coverage is more likely on the FDA approval route, at least for the approved condition. So for somebody with MDMA assisted therapy who has PTSD, the likelihood of insurance coverage is reasonably good. But once you start doing off-label, if you're doing MDMA for eating disorders or couples therapy or whatever, and certainly if you're doing psilocybin, there's not really an insurance coverage route there. So the lack of insurance coverage at the state level is, I think, an issue in the near term. And I do believe we can work on solutions to that in the longer term. So that's all a kind of, I don't know, complex way of saying that I went from thinking any kind of state ballot initiative on psychedelics was a terrible idea to thinking that actually it makes a lot of sense as long as you do it right. And I do think in Oregon, the drafting process got it as right as you could the first time around. And then the implementation process is really going well. And Sam's going to talk about this in terms of fine-tuning exactly how it's going to work. Now, I'll just close by saying Oregon is just the beginning. In 2 days, is that right? Today's Sunday, Monday, Tuesday. In 2 days, the voters of Colorado will have their votes counted. Most of them have actually already voted because it's a vote by mail state, but they will have their votes counted. And if our polling and sort of campaign execution is correct, we believe that Colorado will join Oregon in creating state-regulated access to psilocybin. It will have a 1-year implementation period. because we hope to learn from much of what already happened in Oregon. And it will create a pathway for the other plant medicines, for ibogaine, ayahuasca, and non-peyote derived mescaline to also be accessible through a therapeutic state-regulated system. Now, I will add, in both of these states, there is an underlying decrim provision, which means if you have a personal use amount of the substance, you will no longer face arrest. But I also want to be clear that the route for, I think, most people will probably be through the state-regulated route. I mean, just think about anybody that you know in your extended family. Would they go to the, self-proclaimed knowledgeable person doing it underground, or would they rather go to a state licensed person who has been trained and certified? At least if I think about my aunts and uncles and parents and grandparents, they would choose that latter route, even if some of our friends might choose the former. So Colorado in 2 days. And then after that, I believe that with sufficient funding, we will move relatively rapidly in the next 5 years, such that a majority of the people in the United States will have access through a state-regulated route. And many of you are in Massachusetts. And I think at the last segment of today's conversation, we could talk specifically about what would it take to start the process of doing this in Massachusetts. So with that, I'm going to pause and hand it over to Sam to talk about implementation of the Oregon law. And before I do, though, I just want to say I have really enjoyed getting to know Sam and working with him. He was the campaign manager for the Measure 109 campaign, did an extraordinarily good job. And we were so lucky to be able to really have a seamless transition to having him be the executive director for the entity that would implement Measure 109, which is the Healing Advocacy Fund. So he's really is doing a spectacular job. And Sam, I can't thank you enough every day for what you're doing. So take it away.
Well, thanks for the kind words, Graham. And hi, everyone. Good to meet those of you who I haven't met, and hello to those who I haven't seen in a little while. I'm going to go ahead and share my screen. We're going to go through a quick presentation that is a little bit of everything in terms of the campaign itself, how we won in November of 2020, what we've done post-passage through the work of the Healing Advocacy Fund, and a little bit of a sneak peek as to what's to come as this program goes live next year. So let me go ahead and dive in. Really quickly, as I think Alex had said before, the Healing Advocacy Fund is a 501c3 that really exists to support the thoughtful and effective development, implementation, and education of Measure 109 here in Oregon. You're going to hear me use the word education a lot throughout this presentation, and there's a lot of really good reason for that over the next couple of slides here. So really quickly, I want to say I'm going to give a recap of Measure 109. This is a 100,000-foot view of a recap. It is a 71-page piece of statute, and the rules are additional hundreds of pages that are getting wrapped up right now in final draft form. So there are lots of pieces of information not contained in this slide, and happy to provide additional resources to additional information post this presentation as well. So I want to present the problem statement that we pose to voters, one that I think most people on this call are probably very familiar with. In Oregon, or actually I should say nationally, 1 in 5 Americans were reported to be experiencing symptoms of clinical anxiety and depression. And specifically now in Oregon, 1 in 3 are saying that they are experiencing those symptoms as a result of COVID. That, coupled with the unfortunate fact that Oregon's mental health crisis has been dubbed the 3rd worst in the country, especially as it relates to funding and access to different treatments. So leading in with the initial introduction to what a potential solution might be, we really highlighted the research, the rigorous studies that have been going on at prestigious medical institutions from Johns Hopkins to the University of Alabama. We were really able to lift up and highlight a lot of the promise that research has shown to really meet people where they're at, right? Here in Oregon, there's a whole swath of different voters that we were able to appeal to, including folks who are more conservative, who may not appreciate Johns Hopkins and the work that they do. That's where we're able to really highlight the entire breadth of different universities from different geographical areas that really shows the promise that psilocybin has for end-of-life anxiety, addiction, depression, etc. In addition to that, we were also able to utilize the breakthrough therapy designation that the FDA had recently given psilocybin for treatment-resistant depression. I really think that was a way to help highlight a little bit of the federal hypocrisy in psilocybin being a Schedule I, and really that it was less of a medical designation and more of a political one. And I think that resonated with people as a way to soften the ground for the additional information that was to come, which is the measure itself. So the primary goal of Measure 109, create a licensing and regulatory framework to allow those who are seeking psilocybin therapy to have access in a safe, effective, and affordable manner. A couple of the quick pillars of the measure itself: it establishes a regulatory framework within the Oregon Health Authority, which is the licensing authority that will allow trained practitioners to administer psilocybin services at specially licensed service centers. The measure also created the Oregon Psilocybin Advisory Board, which is a broad panel of experts in a variety of different areas, all appointed by the governor, that are in the process of wrapping up their work now as it relates to the rules process. The measure, as Graham had mentioned before, also imposes a 2-year development period before initial licenses are granted. As the first state to ever move forward with this type of licensed and regulated model, we understand and recognize our responsibility in going first and really ensuring that we set a foundation on safety and quality of services that really is worthy of replication. We are not trying to hit home runs in the first inning here. We're trying to ensure that we have a path for the long term to ensure that as states continue to come online, to the extent that they replicate aspects of Oregon model, they can withstand the test of time and continue to expand access for those who stand to benefit. The measure also creates 4 different license types for facilitators, service centers, manufacturers, and testing labs. And of course, it requires establishment of a tracking system for all psilocybin products as well. Just as importantly, for certain audiences, it's important to highlight what the measure does not do. As Graham had mentioned, there are no retail sales allowed under Measure 109. There is no off-site consumption, possession, or production allowed under Measure 109. Again, all products have to be tracked. There'll be no unregulated, untracked production, delivery, or inventory. Service centers have to be at least 1,000 feet away from all schools, and you need to be 21 or over in order to access services in Oregon. So very briefly, this is a quick diagram of the 4 steps in which psilocybin services will be accessed in Oregon. The first is assessment. This is really where a client seeking psilocybin services and a facilitator will really be able to understand whether or not they're a good match for each other. As Graham has mentioned, there's a lot of people seeking psilocybin services for a lot of different reasons, from folks that are struggling with end-of-life anxiety, who very well may want support from people already within their existing medical community, their hospice program, et cetera. They deserve access and they need to be able to have experts meet them where they are at. And additionally, psilocybin services will be sought for general wellness and preventative purposes, right? And so the facilitators, in addition to the mandatory requirements and training for licensure that they have to have, we also hope we'll have different specialties so we can really help incentivize matching clients with facilitators to really meet not just their general needs, but their more specific needs as well. So the second stage is intention setting. This is likely where the client and the facilitator will actually meet either electronically or in person to really dig deeper on what to expect from the session, to review safety plans, protocols, things of that nature, and really get a good sense of each other and to develop a deeper relationship to really allow for the third stage, which is the administration of psilocybin itself, to go as well as possible. And so again, this is the stage where psilocybin will be provided by a service center to a client at a licensed service center under the constant supervision of a licensed and trained facilitator. And number 4 is, of course, integration. This is mandatory for all facilitators have to offer integration to clients. And as we've seen from a lot of research, both clinical and anecdotal, the integration really is one of the most essential aspects for prolonging some of the positive benefits that we've seen from psilocybin. So those are the 4 steps overall. Again, very high level, but want to provide a little bit of a visual in terms of the order of operations in which someone would go through in order to seek psilocybin services. So as promised, we're going to talk a little bit about the value of education here. These are the 5 questions that when we were able to provide answers to what I call the soccer mom and grandparent demographic, these are the folks that you need to win over in order to have a chance to pass something like we did here in Oregon. And so when we were able to explain to them what psilocybin was, what the research says, what the measure does and does not do, and last but certainly not least, helping them understand that while psilocybin may not be for them and certainly is not a cure-all panacea, that someone that they know and love in their life probably stands to benefit from having access to this. And so when we were able to share stories of healing and really help people understand that even though this may not be for them, someone that they know who is suffering could potentially benefit where existing options are just not doing enough. When we're able to help people really understand that with this information, we were able to win here in Oregon. That's what allowed us to get the 56% that we ended up with in the state. And I want to provide a little bit of a map here in terms of where the support was throughout Oregon. These are the various counties in Oregon. And to contrast this, when Oregon legalized adult use cannabis, 3 counties voted in favor of legalizing adult use cannabis. And that was 4 years prior, or actually 6 years prior, excuse me, to Measure 109 passing. And now we have almost half of all Oregon counties voting in favor of Measure 109. And I highlight this to show a trend that I think is only starting to pick up steam, which is that psychedelic medicine is starting to transcend partisan politics in a way that very few other issues can. That's not to say that you still don't have, a little bit of a conservative, progressive makeup here. Obviously, all of Eastern Oregon is a purple and a no here. But the fact that we're starting to see an uptick in interest from other conservative counties around is really highlighting, I think, an opportunity that we have to continue to transcend partisan politics in a way that helps people put the partisanship that lives in the day-to-day of the regular political discourse aside and really say, let's really take a look at this and see who stands to benefit and put our personal opinions attached to other politics aside. So moving into the implementation phase, this is a very high-level timeline. As you can see, we are starting to wrap up almost 2 years of the rulemaking process that will be going through the end of December. I'll talk a little bit about this in a few other slides, but in September, we saw the first training programs be certified by the Oregon Health Authority and now licensed by the Higher Education Commission. That's very exciting. We'll talk about that in a couple of slides here. On January 2nd is when applications will be made available by the Oregon Health Authority for future license holders. I want to emphasize that, and that it's been confused in the media and among other stakeholders as well, and that services are not going to be available on January 2nd. Applications will be made available by the licensing authority, and we anticipate sometime around March, licenses will likely be issued by the Oregon Health Authority for manufacturers and testing labs. And then sometime after that, maybe in the middle or later of 2023, we expect service centers to start opening their doors to the public. There's a lot that these licensees need to go through above and beyond state and local licensing that requires them, that's required for them to open their doors. And so, that's the general timeline that we're working on right now in terms of doors open for services being accessible to the public. This is a little bit of a preview in terms of a lot of the stuff that we've been working on here at Healing Advocacy Fund over the last year, really. There is an ability for cities and counties to opt out of the program here in Oregon. This is something that we know we generally need to include in order to not have a whole lot of different opposition oppose the measure itself. So we have on the ballot here in Oregon in many different cities and counties a question as to whether or not cities and counties will allow access to the program. With that said, we've done a lot of really good work over the past year in educating cities and counties on what this program is, what it is not. And I'm really happy to say that 17 of the top 20 most populated cities are actually moving forward and allowing legal access for people within their jurisdictions. Let me be clear, this is simply allowing legal access. There's a lot more work to do to ensure that licensees have the support that they need to be able to start businesses and actually be successful in providing safe, quality, and affordable access to these services. So there's a lot to come, but that 2.5 million folks that will have legal access, that it will not be prohibited, is definitely a win, and we're looking forward to expanding and building on that as we move forward. So communications and strategy. So communications has been absolutely essential. Again, we have done a lot of work in really working with the media to help them understand what the measure is not, and really to get the facts straight on the promise that psilocybin shows, and really to help dispel the myths. You know, here in Oregon, we have adult use cannabis, obviously, and so there's a lot of assumptions that people make in terms of, well, they have adult use cannabis, this must just be selling mushrooms at retail stores. As Graham noted, that is not the case. And we are constantly still doing a lot of work on the education side with the media and with the general public on what this measure is and is not. And while some people may see that as a barrier, we see that as an opportunity. We know that there are people that we're not going to convince overnight that this is for them or that they should allow access, and that's okay. We're willing to work with people and really meet them where they are at in order to continue to work with them over time. And I think that that is a strategy that has proven successful through our communications and being able to really educate people through the media. The second part of the strategy here is service centers and training programs. The Healing Advocacy Fund is working on developing online resources and workshops for operators, learning collaboratives, and we have a scholarship program for promising facilitators in training that also has a very specific focus on directly supporting facilitators that come from underserved populations, right? I think it really needs to be continuously acknowledged that if we want to put our money where our mouth is in terms of creating access to populations that either have been disproportionately affected by the war on drugs, that have not had access to healthcare generally, and or that may not be able to afford direct access to psilocybin services, that we are supporting the licensees that come from those communities to work in those communities. And so I think we are just getting started on a lot of our service center work. There's a lot of work to do there, but very excited to continue to provide technical support and resources to those who are really focused on supplying access to currently underserved communities. Safety, as Graham said, the entire foundation of this program absolutely, demands a foundation that is built on safety. And so we're constantly advocating for strong safety regulations, for training, for healthcare systems, and eventually, law enforcement and crisis response resources will also absolutely be necessary in order for this program to really be a success in the first couple of years and over the long haul as well. I also want to lift up, data and research, supporting system-wide data collection to track program and treatment outcomes to create opportunities for applied research. It's going to be absolutely essential that we're able to provide information on whether or not this program is working and who's benefiting, and really utilizing that information to ensure that we can continue to provide access to those in an affordable, equitable, and quality type of manner. And I also wanted to stop there and see if, Graham, did you want to speak to some of the additional research opportunities that might be presented here in the Oregon model?
Sure, I'm happy to. And not sure if Sherry, if you're in the control booth here, you have to put the spotlight back over on me. But in any event, it's just a short point. Many of you are researchers. Many of you work with researchers, and the research that's being done right now in the United States and most places of the world is in a clinical model where there's this high barrier of FDA, DEA, all the different approvals that you have to get. And generally, most of that research is directed towards trying to get FDA approval. So it's in these very controlled circumstances of basically, let's have everyone be as identical as possible with the same condition that's being treated, controlled for all the variables. And the only thing that changes is either you get the drug or you get the placebo. So you can find out, how effective the drug is or the drug therapy combination is. And you're usually looking at one thing at a time. And there's a tremendous amount of growing interest in real world research or pragmatic research, basically where the data set is not the 10 people or the 20 people or the 50 people in your clinical trial at tremendous expense and, again, lack of variability, but really looking at the real world and all the different treatment that's going on. So much of what we're learning about cancer treatment, for instance, are these massive sets of people being treated in all kinds of different circumstances, but compiling that data to learn truly amazing and new things. A lot of that knowledge is out there with psychedelics right now in the underground, but of course, none of that knowledge is being captured. And so Oregon provides a context in which there could be a different kind of research done, looking at a larger group of participants and gathering that kind of real world knowledge. We think that is tremendous to advancement of science, to advancement of safety, to understanding better, what works well and what doesn't work well. And of course, it all has to be done with tremendous care to make sure that people are being protected in every possible way. But we think Oregon is a place where that can really take off. So if you are a researcher and you're thinking about whatever questions around psychedelics you want answered, think about Oregon as a place to potentially add to your data set, and soon Colorado as well. So anyway, back to you, Ben, Sam.
All right. And last but certainly not least is policy, and just ensuring that the Oregon government has the support they need to establish high quality regulations to support the access to psilocybin services. And we had a historical first a couple of weeks ago that I also wanted to lift up. The InterTrek program was the first of now several training programs that has been fully certified and licensed. And I just wanted to share this quote from Tom Eckert, again, one of the founding architects of Measure 109, who says, "Facilitator training is at the heart of the nation's first statewide psilocybin therapy and wellness program. This is about competency, community, and preparing professionals for successful careers as licensed psilocybin service providers in Oregon." So there are people, now several hundreds of people, that are now currently in the process of being trained to eventually receive a psilocybin facilitator license later next year in Oregon. That's a pretty exciting moment. And starting to wrap up here, these are some of our principles, which may or may not have already been evident throughout the slide. The pillars here are safety, quality, access, and learning across the board. We're really focusing on co-designing with local stakeholders and national experts. We do not pretend to know it all, far from it, but we do want to continue to create space and containers for collaborative learning and creating pipelines to share that learning, not just with stakeholders here in Oregon, but with stakeholders hopefully in Colorado and other states to come as well. Again, this hits on the same subject here in terms of staying coordinated with other branches of the psychedelic community overall is absolutely essential. Being responsive and dynamic in a fast-changing environment. For example, the training programs that we mentioned before actually had a pretty big licensing hurdle that no one really knew about. And at one point, the hurdle that we were looking at was going to prolong the launch of training programs by up to 9 months. We were able to work with community stakeholders and the different government entities to really sit down and help everyone understand that we can't afford to wait to start the program 9 additional months. And so we were able to come up with some solutions that allowed for the expedited process of HEC licensures to work with the Oregon Health Authority to ensure that those programs could start on time. And last but not least, of course, taking learnings from Oregon to future state models, as I had mentioned. And in wrapping up here, there's some long-term impacts as well that we're going to see in terms of millions of Oregonians and out-of-state visitors from all walks of life having safe access to psilocybin for healing and wellness. As Graham had properly mentioned, Oregon becoming a learning lab for training, service centers, safety standards, accountability, and ethical guidelines and equity to inform the structuring and implementation for other state and national models. And last but certainly not least, Oregon is the first place in the world where psilocybin, MDMA, and ketamine therapy will likely be legally practiced. And Oregon's practitioners will become some of the most experienced professionals in this space. And with that, I will go ahead and stop sharing my screen and hand it back to you, Alex.
Awesome. Thanks, Graham, and thanks, Sam. I think we covered a lot of ground, and I imagine, well, I for one would like to dive deeper in a handful of areas, and I'm sure others would as well. It looks like we already have some great questions coming in. A reminder to folks to just post their questions in the chat, and yeah, I'll just dive right in because it seems like we've got a bunch of good questions. Chapman's curious, what was the governor's role in getting 109 passed? And I'll tack on an additional question. How can who the governor is or isn't potentially derail the future path for this? Is it a risk factor? And what are some of the risk factors beyond the core implementation, other political risks?
Graham, do you want me to go ahead and take that one? Do you want to jump in?
Why don't you take the first part and then I'll take Alex's second part.
Yeah, the first part is easy. The governor's role in getting Measure 109 passed, the governor didn't really play a role. The governor certainly did not voice support for or against. We knew that, behind the scenes, she was generally in favor of it, but governors don't typically get involved in an endorsement process for any type of measure in general. So that's the easy answer to the first question. I'll hand it over to Graham for the second.
Yeah, and so for future states, there are two ways to get these laws enacted. One is through the legislature, and there you need a majority of the members of the legislature, and you need the governor to sign it. And you basically need enough breadth of political support, almost consensus. And whatever happens through the legislature, usually there are compromises and changes, and it's sort of less than ideal. But it is sometimes way less expensive to do. So that's the legislative process. Through the ballot initiative process, you get to write the ballot yourself, the law yourself. So you put exactly what you want to be in there, and you go directly to the people. So at least in theory, if the governor opposes it, it doesn't really matter, right? It's what the majority of the people want. And we know from ballot initiatives on everything like marriage equality and environmental issues and cannabis reform, that sometimes is done over the opposition of elected leaders. But I will say this, implementing these laws is complicated and really does require cooperation. And so I think at least in the next couple of years, we will be focusing on places where the leadership of the state in the legislature, in the regulatory agencies, and in the governor's office are supportive enough that they're not going to try to sabotage the appropriate implementation. So, it's not a prerequisite, but it's a really good idea to try to build that political support.
Cool, thanks. Penelope asks a great question. She'd like to know what the licensing requirements will be for therapists, and will there eventually be reciprocal acceptance for programs such as the CIS's CPETR program or other training programs?
Yeah, so there is a whole host of requirements. The biggest one is that all people seeking facilitator licenses will need to go through a training program, the ones that I have mentioned that have recently been certified and licensed by the state authorities. And so that will require a minimum of 120 hours of training with an additional 40 hours of practicum. And many training programs are going above and beyond those minimum requirements in terms of the hours in which that will be required in order to graduate from a training program and then apply for your license as a facilitator. And so I will go ahead and post in a resource for anyone who really wants to dive in. That is the Oregon Health Authority's website that will have almost all of the information that you might be looking for in terms of existing state statute and what's required for that process, as well as some of the rules that have already been finalized and some of the draft rules that are being wrapped up now.
Let me just
oh yeah, please,
I'm
Graham.
going to add a quick thing to that too. I mean, in this, first cohort of approvals, we really want to make sure that quality is at a high level. And so there'll be redundancy in that training. Somebody who's already been trained at one of the programs that you mentioned, Alex, is already going to know some of this stuff, maybe even a lot of it. I think over time, as the system matures, there will be an ability. I doubt that it will be that you can just, sort of get grandfathered in or what have you from another program. But if you can demonstrate that you already have competency and training in certain areas, you wouldn't have to sit through those classes a second time. It makes sense. But I think you can also appreciate how at the front end, you want to err on the side of caution to make sure that that we don't have bad outcomes.
And I just wanted to add a follow-up question. In terms of the practicum piece, because I know this has been a topic in the context of MDMA as well, will there be a requirement or even an opportunity for therapists to serve patients or participants in a medicine guided session, and in turn will therapists or guides have the opportunity to experience the medicine as part of their training?
Yes. Yes to both. Yeah, I mean, it'll in the first year there will be a couple of different aspects of that, given that we need to have products up and running in order to do that. But yes, I think both of those will be allowed. And we're constantly working with other licensing boards to help better understand, to what degree do they have questions about this program, and really ensuring that additionally licensed credentialed professionals have the ability to not only interact with, but participate in this program. We really feel very strongly that in order to have a backbone of safety in the first couple of years, that creating as much room for existing licensed healthcare professionals to exist within this program is essential to help them really ensure that we are meeting the needs of some of the folks that might have more complex health histories and backgrounds.
Got it. Thanks. Rebecca is curious about how Oregon will handle non-Oregonian residents or non-Oregon residents seeking treatment, particularly those in the veteran community. And then I'll append onto that, as I've been doing with these, a question around just generally for folks outside of Oregon, whether they're practitioners or wanted to open a service center or what have you, if that is possible and how that would work.
So there are no residency requirements under Measure 109 to access services. So anyone will be able to have access to services so long as they can go through the steps to ensure they can safely benefit and access those. I think there's a larger question that has yet to have a full answer in terms of how the communities within Oregon will work together to help assess need, right? I mean, there is clearly a need outside of Oregon. There is clearly a need inside of Oregon. And so I think there's going to be a lot of work that still needs to be done, especially once service centers start to get their footing and really start to get up and running in terms of working together to hopefully prioritize access for certain populations. And so I think there's a lot of work to be done on the how and the infrastructure for prioritizing that need. But overall, you do not need to be a resident of Oregon in order to have access. And I do think, of course, there's going to be a huge demand from a lot of the populations that we know, veteran community, end-of-life community, et cetera, seeking access here in Oregon. And as far as the licensing goes for facilitators, there is a 2-year residency requirement for facilitators in Oregon. That does sunset in 2025, but between now and 2025, you do need to have 2 years as a resident in Oregon in order to apply for a facilitator license. I want to emphasize, apply for a facilitator license. That residency requirement is not applied in order to join a training program. So in theory, you could join your training program today, and some time in the future, maybe near the time of your 2nd year of residency, you would be able to qualify. With that said, again, keep in mind that rule does sunset in 2025, and from therefore, there will be no residency requirements for facilitators.
And what about the training schools, Sam?
So the training schools have no residency requirements either in order to run one or participate in one. So again, you can definitely get started now. And again, by the time you graduate those training programs, you may be pretty close to 2025 to where that residency requirement goes away at that point too.
And of the first 5 schools approved, at least one of them is actually out of state, right? The Berkeley program.
A couple, yeah. Berkeley and the Soundmind Institute, which is, I believe, on the East Coast as well, has also been approved.
And in terms of the different service centers and training programs and such, how is are things written to either enable or prevent consolidation? I mean, in theory, could one business end up facilitating, 90% of the psychedelic therapy or retreats in Oregon, or are there protections to kind of limit that type of a dynamic? So I know that was a big topic in cannabis in Oregon.
Yeah, so there is not any kind of preemption on consolidation. It's a really interesting question. What I can say is that the Oregon model does not have any limited number of license types, license caps, or anything of that nature. So there's flexibility in terms of not just how you structure that business, but who else you can incorporate with. Vertical integration is allowed, but is not required by any means. And another example of flexibility is that facilitators can be employees of service centers or can be contractors. Again, we know that there's going to be a lot of facilitators that have very specific backgrounds, and it will make sense to be able to geographically spread their experience and their offerings in different parts of the state where it may be in unique demand, as opposed to just one general city or a certain county.
Well, I think one thing that may be responsive to Alex's question, though, is that for service centers, no one person or entity can own more than, I think, 3 of them. Is that right, Sam?
5 is actually the cap in terms of, yeah. Yep.
So you're not going to have, sort of one corporation gobbling up all the service centers.
Cool. Very helpful. Thanks. John asks or notes, the Healing Advocacy Fund has repeatedly emphasized the need and importance of safety within the 109 program. What are the particular safety concerns you're most worried about? And I guess as a follow-on, how you're specifically mitigating against those.
Yeah, well, I'll take a first shot at this, Sam. Safety is important both in terms of actual safety and perceived safety. Those are both important. In terms of actual safety, I will say I've been really influenced by talking to Roland Griffiths and his team at Hopkins, and I believe they're working on publishing a study right now that is going to look qualitatively at some of the really challenging safety issues that have come up, even in the most highly trained, well-controlled, well-screened situations imaginable. So that's just to say that psilocybin is not a completely safe and harmless substance, that nothing bad could possibly ever happen. So that really gets my attention and makes me think about both how there are mental health contraindications, other drugs that one could be taking that are contraindications, that there's importance of both preparation and integration afterwards, not just for good outcomes, but also to prevent bad outcomes. And I think for anybody who's worked very much with these medicines, this is familiar territory. So that's the kind of terrain of safety, of actual safety, that we're concerned with. And then in terms of perceived safety, both MAPS and the early days of its FDA approval, which we hope is coming, and Oregon in the early days of its psilocybin program, the world is going to be watching. And any bad outcome that happens, and certainly anything that really horrific that happens, is going to have such a spotlight on it. And that could lead to a kind of backlash across all of the good work that many of us are doing. And so there's a big responsibility here of both keeping patients and clients safe, but also in making sure that it's a system that is attuned to safety, so that when something goes wrong or less than ideal, as it inevitably will, as it does with any kind of treatment or therapy or medication, when something does go wrong or less than ideal, that we're in a context of saying we really put in place training and safeguards and all of the things that aim for the best possible outcomes, and also learn from and address anything that goes wrong. So that's kind of the safety context as I look at it.
Thanks. Anad is curious, is asking about nurse practitioners and RNs specifically it being included in the implementation period conversations to ensure broader equity, accessibility, and affordability for Oregonians. So asking about inclusion of those groups as part of the coalition. I'm also curious, expanding it just more broadly to the different healthcare systems, private or otherwise, in Oregon, how they've been engaged, what their current sentiments are towards this, and whether it's happening, as something fairly separate from the hospital systems and other entities in Oregon, or whether they're engaged in some way.
Yeah, I mean, regarding nurse practitioners' involvement in the process, Steph Bars is one of the nurse practitioners that currently is on the advisory board. She's based out of Bend and has a very keen interest from not only a nurse practitioner background, but from an end-of-life background as well. And I know that she, probably plans to work in this space in Bend from a nurse practitioner's perspective. In addition to that, I know that there is a growing cohort of nurse practitioners here in Oregon that actually just recently met with a couple of weeks ago that not only want to participate in the program, but that want to start utilizing their role as nurse practitioners, which are generally on the front lines of helping educate their clients and patients, to start educating the general public and their future clients and other nurse practitioners on the program itself. So there's a lot of involvement from nurse practitioners as well as other licensed professionals in that program. And I'll hand it to Graham in terms of the broader context in which this may have, and hopefully will eventually start to be able to interact with other healthcare systems.
So I've had off the record conversations with senior leadership in a number of healthcare systems that are deeply interested in this, and it makes sense. I mean, the difficulty of providing adequate care for people with serious or even not so serious mental health challenges is really at a crisis level everywhere. And so if you're running a healthcare system and there's a promising new treatment or therapy, of course you're interested. But here's the catch. The Oregon program is not consistent with federal law, right? Psilocybin remains a Schedule I illegal substance. And so the growing and transporting and handing over of psilocybin to a client is not consistent with federal law. Now, we have good reason to believe the federal government does not plan to enforce federal law. But if you're a hospital, a medical care system, what have you, anybody who is heavily regulated by state and federal authorities, you're not going to be involved in actually distributing a Schedule I substance. However, and this is a really important point, I think as the program gets rolled out and implemented, there's a good possibility of kind of disaggregating, pulling apart the providing of the drug and the providing of the therapy. And so could it be the case that the psilocybin activity happens adjacent to the healthcare facility where the hospice, the mental health care therapy takes place? I hope so. But that's not going to be what happens on day one. That's something that's going to have to be explored over time. And so, the early adapters in this are not going to be sitting inside of a hospital system. But I really do believe in 3 years from now, we're going to find that it actually is integrated into it in important ways.
Thanks. And can you touch a bit on the payer infrastructure possibility, and if that were to happen, how you'd see it happening most readily and effectively?
Yeah, well, I mean, it's basically a similar problem, right? Insurance companies, they're heavily regulated. They're, risk averse in a whole bunch of ways. And so they're not going to provide coverage for the cost of the psilocybin itself anytime soon. But I think that there is a pathway towards them covering the cost of the therapy. And so there's a lot of work to be done in terms of creating the proper codes and all of that. And MAPS is very involved in it. USONA, others are involved in trying to figure that out for the FDA approved route. But I think some of that will end up applying in Oregon as well. And then the other thing that I think is, this is cutting edge, but it's not crazy, is that state Medicaid systems often reimburse for things that federal law doesn't allow or even explicitly forbids. And so there is a world, I think, once you actually have enough of a track record of showing that this is cost savings, which it certainly seems like it will be, that a state Medicaid system in Oregon could set up the infrastructure to do that. Again, that's not going to be on day one, but I think it could be a few years down the road.
Right. It's apparent that a lot has been happening both through the ballot measure and implementation, and now going into the rollout of this. But I'm curious. This is a group of folks who are largely not really neophytes to the advancement of advancement of access to psychedelics and research. I'm wondering if you could share some of the bigger obstacles, roadblocks, challenges you faced, whether there's been any deviation that you'd note from the original ballot measure and how this has ultimately been rolled out through implementation with the Oregon regulators. What are some of the more candid challenges that have been taking place?
I mean, the honest answer, Alex, is we're going to start really discovering those in a couple of months. There's been 2 years of really important process of gathering expert opinions and drafting draft regulations and getting notice and comment. And we're still in that. We're still there's a really important process happening around the safety regulations right now that are going through multiple iterations. But once we actually start opening the doors to serving clients, I think is where we're going to find out, the biggest difficulties. I don't know. I guess there's one thing that does come to mind that has come up in talking with people who want to operate service centers, which is that the economics of running a service center are really tough, because the service center is the entity that's actually receiving the psilocybin from the person who grows it and providing it to the client. And because that's federally illegal, there are a lot of difficulties around banking and taxes and things that people involved in the cannabis world can appreciate. And so I think one of the things that I think may end up happening is, instead of having a service center that's doing everything, including the therapy, this is sort of a theme that you'll notice with what I'm saying, is the kind of disaggregation of it, that the service center is more just doing the one piece around providing the substance, and the therapeutic or holding space piece of it is going to happen under a separate business entity. I will say that distinction is not something that really was apparent in the drafting process, but is becoming more apparent as we talk to people who are putting together business plans and saying, how do we make this work? So they're probably, I suspect Sam probably has a list of 100 examples because he's much closer to all of this, but that's the one that comes to mind for me.
Graham probably highlighted one of the biggest ones right now, which is, in addition to the federal legality, 280E, taxes, business experience, plans, et cetera, it's real estate. The cost of real estate has never been cheap, and it's often, utilized for higher price points, right? And where the little bit of real estate that you can find that is not only compliant, but isn't owned by a bank. That's tough. And those are tough things to navigate. And those are some of the things that we're starting to dig in right now, and, providing resources for people to really understand what it will take to run this business, whether or not this is something that isn't what they think it is. And if it is, how to continue to provide technical support and resources to really ensure that we have a full breadth and a portfolio of quality operators in the first couple of years is going to be essential for the long-term success of this program.
Yeah, I'll take your question, Alex, as an opportunity to just invite all of you to do some thinking. That is, expanding one's mind. I think most of us who've been working in the field around psychedelics initially were really interested in, well, how do these medicines work? What are they doing in the brain? What are they doing, within our bodies, within our spirit, within our hearts? How do we create the right setting to optimize that? And sort of like all of those questions about basically what happens in the room where this experience takes place. And then I think a lot of people have poured energy into thinking, how do we navigate the route to FDA approval? So all the sort of clinical trials and evidence that need to be created to get to FDA approval. But there's this whole frontier that happens after either FDA approval or a state like Oregon creates regulated access, which is, how do you actually create the infrastructure for delivery of care? It's tremendously complicated. It is so challenging, and it's building something that just doesn't exist right now. We have a mental health system that has therapy, and we have one that involves drugs, but we don't have anything that has this kind of combination. And so the training, the infrastructure, the physical place of it, the regulatory system, the insurance, all of that, it's so interesting, so complex. And you know what? The first place that this is going to be tried out is going to be in Oregon over the next 12 months. So really, pay attention. And if you're interested in any aspect of it, come on in and help us figure it out. It's really going to be interesting stuff.
And I'm going to ask, I think, our final question, which will be from John. But before I did that, I did want to give you a chance. What are the best ways? I know Sam posted some information for folks, curious about the ins and outs of the regulations. What are the easiest ways for folks to learn more or get involved in whatever fashion they resonate with?
Yeah, I would highly encourage people to start with the Oregon Health Authority's website. They have basic overviews of things and incredible amount of depth on currently codified rules, and as well as the public comment process, which is still going on this month. There's going to be 3 meetings, I believe 15th, 16th, and 17th of this month, where people can provide direct comment to the Oregon Health Authority, in addition to submitting comments as well. So there's still time to participate in that process. And I heavily encourage anyone who's interested in simply learning more, or to the extent they want to get involved and provide additional input, to definitely take a look at the Oregon Health Authority's website. It's got a ton of resources.
Great. And we'll include some information to that effect in a follow-up email. Perfect. Well, John, I believe will have the pleasure of the last word or the last question. He asks, or he notes, Colorado included a decriminalization component as part of its regulated program, ensuring that, quote, grandparents and soccer moms get access that feels comfortable, but still ensures that people aren't kept out who can't afford a more expensive system. I guess I'll phrase it as, how are you thinking about tying decriminalization to further rollout of these state-wide regulated measures, and is it reasonable to expect that those two things will go hand in hand? Or feel free to comment.
Yeah, well, I'll say a couple of words about that, and then maybe take that as an invitation to talk about Massachusetts, because I think we wanted to talk about that a little bit before we close here. Happily, no one is the king or monarch of what's going to happen with psychedelics. And so it's an iterative process that relies very much on what the people who take the initiative in a given state want. And so, through the work that I've done in different organizations like New Approach and the Healing Advocacy Fund and PSFC, we've been involved in supporting in Connecticut a model that doesn't have decrim or state regulated access. It's only about once there's federal approval that there would be access. We've supported a bill in Texas that is funding for university-based research around psilocybin and MDMA. We've supported a bill in California that is much more towards the decrim end of the spectrum than some of the others. And so I'm pragmatic. I think that the team that we put together is pragmatic. We want to look at what the people in a given place are wanting to do and provide them resources and expertise to do it well, to ask questions. Sometimes I think people, and I started with the story of Tom and Cherie and their eagerness to engage in dialogue with people from outside of Oregon and to learn and refine their model. So I mean, I'm simply not in a position to make a commitment to what the next bill will have or won't have, or the 10 after it. I mean, it's going to be a process. And I think that, I will also say, with the modesty of knowing that none of us really know what's going to work best. This is super complicated in terms of all the intersections of state and federal and local law, of science, of public opinion, of public health, of economics. And so I think trying out different models, seeing what works and refining them makes a ton of sense. So Massachusetts. Massachusetts is a state that has a ballot initiative process. I would be very excited for those of you who are in Massachusetts to come together and invite our participation in your conversations about starting to draft a ballot initiative for 2 years from now. I played a key role in running the ballot initiative that legalized cannabis in Massachusetts in 2016, I believe it was. And so I kind of have a little bit of a sense of the process and the politics of the place. We haven't done polling there yet, but from polling we've done in a few other places and nationally, I would guess that Massachusetts is in a pretty receptive place to do something that had the elements of Colorado and Oregon, but with its own special Massachusetts, sort of frame to it. So I welcome you all taking that initiative. And can commit to giving it time and bringing in information. And, if the pieces are all there, and a big piece of it is funding, by the way, running one of these ballot initiatives in Massachusetts would probably be somewhere in the $6 million range to gather the signatures and execute a good campaign. But if we have the right team of people, the right expertise, the right political climate, the right public opinion, and the funding, then I have very little doubt that we could do this in 2 years. And as we approach election day in 2024, we could be looking forward to Massachusetts becoming one of the next states to create state regulated access to psychedelics.
Thanks, Graham. Rebecca's just quickly asking if you happen to know of anyone already working on this in Massachusetts, or whether it's a generally open call.
I am sure that there are, and I think if Ben Unger were here on the call with us, he might even be able to say who it is, but I can't say that I've had that conversation myself with anyone in Massachusetts yet. Sam, have you?
Not yet. Keyword yet.
Yeah.
Great. Well, on that inspiring call to action note, I want to give a huge thanks to Graham and Sam. I think Graham was absolutely right that we really don't know how any of this is going to play out, but it is impossible to dispute that what these two and many others have done in Oregon will represent at the very least a major shift in how folks are able to get access to these medicines and learn more about them. So a huge amount of gratitude to you both for being with us today and despite everything going on. Yeah, thank you for your work. And with that, I will hand it over to Anne. Anne, I think you're muted.
Thank you. So I second all that Alex said. Huge gratitude and admiration to you, Sam and Graham, for all you've done. And I'm certainly willing to try to start finding out if there's anyone in Massachusetts who's interested in doing this or who is already doing this. So hopefully I'll be back in touch with you with some names and we'll get some energy going around this. It's such an important way to help to get these medicines available to so many more people. And thank you, Alex, very much for moderating. It was a very good discussion. And thank you also. I think we're going to be able to post the video up, so for people who couldn't be with us today, they'll be able to watch it. We'll encourage them to do so because there's so much you taught us today. Thank you. Just want to close by inviting everyone to come. January 8th is our next meeting, and our speaker will be Leonard Picard. And he is alleged to have produced 90% of the world's LSD. He was a former drug policy fellow at Harvard's Kennedy School of Government, research associate in the neurobiology department at Harvard Medical School, and the deputy director of the drug policy analysis program at UCLA. With 2 life sentences without parole, he served 20 years in maximum security federal prisons and was released in 2020. Currently, he's a senior advisor and on scientific advisory boards for the Fireside Project, JLS Fund, LP, and SciGen, and probably others too. So we look forward to having him in January. So many thanks to everyone for being with us. Enjoy the rest of your Sunday. Sorry, Graham, to hear why you're in New Mexico. I hope everything goes smoothly, but thank you for joining us during this time of family difficulty.
Thank you so much for including Sam and me in this, and really, Alex, a fantastic job of moderating. And I'm just delighted to kind of meet this community that's been building over the years. And Anne, you've done such a good job of bringing it into existence. So thank you for including this, and thank you for your good wishes.
Thank you, everyone.
Thank you. Have a good day.
Yes.
Appreciate all your work. Thank you. Mhm.
Thank you, guys.
Thank you, everyone.
Thank you.
Bye,
Thank you.
Thank you.